Good. All right, let's go.
This is 20. Why is not there?
Good morning, everyone. This is Cluster 4
Okay.
from Emmanuel Hospital, AKT. So, this is a case of Mr. Aging, an Indian taxi driver he came to the facility with a prescription from a general practitioner, and he was diagnosed of angina. The prescription said he should be given glycerol trinitrate spray. So he came with this prescription and he was diagnosed of stable angina with symptoms of chest tightness. He was given the drug and he went back, and after 2 days he came back complaining of headache, and we understood that this I understood that this was a side effect of this drug. So what I did was to sit him down. Already I had established a professional relationship, because for him to be able to open up to me and tell me what it is, and he even went as far as admitting that he smokes tobacco, or like he smokes for like 5 times in a week, and he asked for my opinion on if he should cease or if he should stop smoking. That means he was able to build confidence in me, and he trusts in my professionalism. So I began to document what he said. I began to document. I took down his age, his demographics, the age, the sex, the occupation, the ethnicity, the disease state, the medication history. And then after documenting that, of course, I already understood that there was no objective data. But then the subjective data said that he had chest tightness and then headache following at the administration of the glycerol trinitrate. So having understood this, I was able to identify the drug and health related problem. Of course, smoking is a predominant factor to developing cardiovascular disease, because it has a way of narrowing the coronary artery and impeding blood supply to the cardiac muscles, which precipitated the angina. Apart from that, there's the headache, which is a drug related problem, which is caused by the drug he was being prescribed. So that's like the adverse effect of the drug he was taking. And also, the patient expressed his reluctance to adhering to the therapy. He wanted to quit. He couldn't continue with the drug. But I didn't just let him go like that. So I went on to design the pharmacological care plan. So what I did, I sat him down. I explained to him. I start by telling him that angina can be cured. I gave him that assurance that he can be managed, he can be well managed, and that there are certain factors that predisposes him. And considering the nature of his job, he's a taxi driver, and his occupation is usually exposed to dust. As a taxi driver, you can tell, even these people that drive here, like the kk, you can tell how the road is sometimes, the dust and every other thing. And then apart from the occupation, his age is predisposed to angina. So I was able to explain this to him, and I emphasized the importance of that drug, because if he doesn't take the drug to help him manage the angina, chances is that he will develop heart attack, his heart will pack up and he will die. So, having made him to understand this, I now told him that he has to continue with this therapy. As for the headache, fine, the headache can be well managed. He can simply rest, or the guideline says that you can give the person paracetamol, a centrally acting analgesic, which will help with that. And a dose of 1 gram 8 hourly will manage that very well. And then the next thing was to schedule follow-up meetings. So I asked him to come so that we can probably monitor him, check if any complication has developed, and then how the severity of the headache as well. So I'll step aside now and then allow my colleague to do the rest.
Good morning, everybody. I'll be talking about the question that was assigned to my own cluster, which says, what, if any, the risk factor predisposing the patient to angina? Okay, angina, we all heard, a, is a condition that is characterized by chest pain, which can sometimes radiate to the arm, to the shoulder, to the neck. So, and this pain is caused by insufficient or imbalance in the supply of blood to the heart when there is increased demand of oxygen supplied by the heart and the coronary artery is not able to supply enough to the heart. Now, there are various factors that predisposes one to angina, which include the age. As one age increases, there is continuous deposition of fat cholesterol in the lining of the vessel, the arterial walls, forming plaque. And as time goes on, the plaque increases, narrowing the flow of blood to the across the coronary artery. This obstruction will lead to insufficient supply of oxygen to the heart, not being able to meet up to the oxygen demand of the heart, resulting to
All right,
angina.
time,
So other factors
time,
include the
time. You talk on the drug management of angina.
The drug management of angina.
Louder.
Okay, the use of triglycerol nitrate for the management of angina, although it had side effects, it's a perfect, I think it's a perfect medication for his um, for his condition, for his angina condition, because it helps relieve some of the fat deposits in the arterioles,
The fats.
Fat deposit.
that causes
What? Glycerol
plaque.
nitrate.
Yes.
How does it
Glycerol
work
nitrate.
to reduce the fat deposit? I'm asking you.
You read it up, or you just feel that's what it is. Fat deposit.
The fat deposit in the arteries that
Fat
causes the
evaporation.
buildup in the plaque, leading to atherosclerosis, which is cardiovascular disease that
That's not what. That's
predisposes
not
to
what
angina.
Is
glycerol does.
GTN a lipolytic agent?
It's not. You are getting it wrong. You didn't get it. So who can help him there?
Let me. So the nitroglyceride or the glyceryl trinitrate is a prodrug, and when it's being metabolized to nitric oxide. Now, what the nitric oxide does is to increase the level of intracellular cyclic GMP, and when it does this, there is dephosphorylation of myosin light chain. So this myosin light chain interact with actin. When they cross link, there is contraction in the smooth muscle. So the dephosphorylation of this myosin light chain will prevent the cross linking, thereby causing relaxation. So the smooth muscle relaxes. There is now a more space for the blood carrying the oxygen to flow to the heart.
In addition to that, it also causes vasodilation. So apart from the relaxation of the muscle, the blood vessels widens for blood to flow.
Okay, so you. What do you think myocardial infarction and angina pectoris?
Myocardial infarction and angina pectoris. Angina pectoris is caused by cardiovascular disease. It's secondary to cardiovascular disease, which is caused by the buildup of fatty acids in the arterioles, in the arteries, that's causing plaque, atherosclerosis. While myocardial infarction is insufficient oxygen being supplied to the heart, to the arteries.
Was who somebody
Do you agree
said
with him? People are always against it. Why?
I think he looks a bit lost.
So what is it between myocardial infarction and angina pectoris? Yeah.
Okay, angina, if not well